Hello everyone, welcome to Vasomeritech EECP Treatment Center. Today we will discuss something different. After we made the video about many patients can able to avoid angioplasty and can benefit from EECP treatment, there are many calls from patients asking whether they have to avoid the angioplasty or they can able to do EECP, it would be better than angioplasty. So to explain to this for every patient, I would rather thought would make a video narrating my experience with another patient and what we spoke about the angioplasty and the EECP treatment. So let me explain in detail, and this is a patient who happens to be a physician. So he walks into the clinic and he was a little bit apprehensive because deep inside he wants to avoid going for an angioplasty. But at the same time, he was a little bit afraid that avoiding an angioplasty would lead to anything to heart attack or decrease his lifespan. So he is a physician as himself, and his recommendation for angioplasty came from a cardiologist who is his very close friend. So elaborating the discussion between me and the physician would give you a clear view, because I am going to explain this to a physician. The first thing is, I asked him, so why did you go to the cardiologist and do your angiogram? So he said, as a physician, he understood it's a cardiac symptom. He was able to walk regularly for a long period of time, but recently for the past couple of weeks, that walking distance has mildly reduced. He said around 20 to 25 minutes of walking, he used to get some discomfort, and then he stops and then the discomfort completely vanishes, and then eventually he started taking some medications to reduce the pain. But in spite of that, he was able to do all his routine activity without any trouble. So he went for a routine consultation. And of course, they did a ECG, and the ECG comes out to be normal. Then his friend, a cardiologist, asked him, why don't you do an echocardiography? So they did an echocardiography, and the echocardiography also normal. So because his symptoms are very typical to of a cardiac patient, his friend asked him to do a treadmill. Now in treadmill he was able to run for almost around 10 to 12 minutes, and after that there was some changes in the EKG, and based on that his friend did an angiogram, and they found out there are two vessels obstruction in the mid segment of two vessels. So this is called double vessel disease, and he was asked to undergo for an angioplasty. Now this is what he elaborated me, and then his question is very clear, because as a physician he asked me clearly, can I able to avoid undergoing an angioplasty? If I avoid going for an angioplasty, what is the risk I am taking? And would I would be a good candidate for a EECP treatment. Now let us go and look at all this explanation he is given. Then we may understand why he will avoid angioplasty without going for any risk of heart attack or reducing his lifespan. Now, when he said he is able to do all the routine activity regularly, we considered him as a stable patient. So his ECG is normal. It means in a resting condition, there is no blood flow deficiency to his heart muscle. And also he did an echocardiography, and the echocardiography is also normal, which clearly shows there is no dysfunction in the muscle. So the heart as a pump is pumping normal without any trouble. Then the third investigation he went is a treadmill. Now the treadmill also he is able to achieve almost 10 to 12 minutes, and after that only there was some changes in the ECG. So when he does some effort beyond his capability, probably there is some deficiency of flow which resulted in the abnormality in the treadmill. Now after that he immediately jumped and underwent an angiogram. Now this is where the problem lies. So patient like him, when he is able to do a treadmill with a good exercise tolerance of more than around 8 minutes, means his long-term risk of getting a heart attack or death is very minimal. I would say per year mortality around 1 or 1.5%. So 5 years it could be less than 3 to 4%. So basically 97% of them will have no trouble at all in getting a heart attack or death. So when he underwent the procedure of angioplasty, he has put himself at the risk of 3 to 4%. And if he undergo a stent, probably the stent related complication could be around 5 to 10%. Putting all together, his risk is higher if he goes for an interventional procedure, and also he has not at all started on any medical management or conservative management. So even if you put a stent, I clearly stated, according to many studies, I will quote Orbita study, and it is Courage trial and Ischemia trial, doing angioplasty in this kind of patient will not reduce symptom or will not reduce the risk of heart attack or will not prolong life. It will only put the patient under the excessive risk of procedural complication. So we can clearly say to this patient who is a physician, he can safely defer this angioplasty and can go for a conservative management with the EECP. It is better off than going for an angioplasty. Thank you. No hospitalization, no pain, no surgery, and highly cost effective.